I'm thankful to Seniman from the Houston Voice, allowing me to talk about the Helping Hands for Hospitals International Incorporated. Helping Hands for Hospitals is Hospitals International Incorporated is a 501c3 charity organization based in 299 Green Street, Aldbridge, New Jersey 08857, United States of America. 2016, November 16, marked the beginning of the Helping Hand for Hospitals when some of the doctors met in Bethany Medical Center in Anagatti, Coimbatore, South India. Dr. Jaison Mathai, cardiologist, former professor emeritus from Christian Medical College, Ludhiana, Dr. Abraham Thomas, pediatrician from New Jersey, and Benjamin George from New Jersey, met together thinking about the struggles many hospitals are going through currently in India. At the time of independence in 1947, India had about 770 hospitals, which was key in running the healthcare system across the nation. The mission hospitals, started by many missionaries, were doing extremely well, and they were able to deliver the health, take care of the health needs in many villages in India. Situations changed as time went by. Today, there are more than 200 hospitals hardly functioning. Many of the hospitals have had to be closed down, and many of the hospitals are going through severe financial, physical struggles to run the hospitals. So this problem initiated the thought process in some of us to start an organization to help these hospitals spread across the different parts of India, especially North India, which had been serving the community wonderfully well. We felt these hospitals should be revived. So 2016, Helping Hands for Hospitals was born, and with the grace of God, we were able to continue the work to cover many hospitals and the needs of the many communities in India. The decline of the efficient medical institutions and the lack of the committed healthcare providers poses the significant crisis in the health delivery system now. Lack of infrastructure is a common factor in the poor functioning of the hospital. Lack of well-qualified physicians, committed doctors and nurses, and other paramedical staff became a problem across the nation. And this affected the health care delivery to the community, especially the community which are poor, and they needed badly the health services by these hospitals. We were concerned about how we could help them, and that's how Helping Hands for Hospitals was born. We vision Helping Hands for Hospitals as an organization to address the infrastructure, medical and human capital needs, and finance of the ailing, reputable and committed healthcare facilities across the nation. We are concerned about the daily functioning of the hospitals, the day-to-day running of the hospitals, which is under great stress because of the lack of finance, lack of proper committed physicians and nurses and other medical staff, and poor administration of the hospitals. So to navigate hospitals in these underprivileged and backward areas out of their weaknesses, and to acquaint medical professionals to the opportunities in these needy institutions is a great concern. We want to improve the working condition of these hospitals by tapping the resources available and connecting the doctors and the nurses and the paramedical staff to the needy hospitals. To begin with, we engaged ourselves in connecting the health professionals to these hospitals, and we were able to send doctors and nurses and paramedical staff to different hospitals for smooth functioning of the hospitals. Currently, we are focusing our attention on North Indian hospitals. Basically, we are working with many organizations like Emmanuel Hospital Association, EMFI, Evangelical Medical Fellowship of India, CMAI, Christian Medical Association of India, and many other voluntary organizations. Every year, we have a medical camp arranged in different parts of the country, across the nation. We conduct medical and surgical camps in Anakatti, Coimbatore, Tamil Nadu. We do arrange surgical camps in Madhepura in Bihar, and every year we conduct medical camps in a village called Sundarbans in Calcutta. Sundarbans means beautiful forest, famous for the tigers in Calcutta, Bengal tigers. God has placed our concern for these villages in Sundarbans where the health delivery system is poor, and with the leadership of Pastor Akhtar, who is working along with the messenger team, we were able to involve in the health care system. And also we found that in addition to the health needs, they lack water, and they also, many people didn't have suitable housing, and the sanitary system was very poor. So God gave us a burden to give them water by giving bore wells, and amazingly, God gave us an opportunity to give. So for 7 villages with pure water drinking facility, 20 houses, and our goal is to build at least 200 houses, and sanitation facilities by building toilet facilities in 10 units we have already finished. Our goal is to make another 100 bathrooms, and we are seriously working to improve the literary conditions in the place, and by providing them training and also empowering the women by training them in their suitable skills like tailoring and agriculture and other suitable jobs. It is amazing to see how the villagers respond, and they want more and more villages want the services provided by the Helping Hands for Hospitals. We are planning to start a health unit in Sundarbans by initially starting with a telehealth program and stationing a doctor and a nurse eventually, and starting a stationary health clinic. Mathai is a district in Bihar, one of the most backward area in India. God led us to Madhepura, where there is already an existing hospital, and Dr. Arpit Matthew and his team are doing wonderful work, and we were able to join them by providing equipments to improve the surgical facilities, microscope for ENT work, and various other operations we could conduct in Madhepura. And amazingly, the response from Madhepura is encouraging. Also, we are expanding our work to other different parts of India. The hospital in Hyderabad, Baptist Mission Hospital, is poorly functioning currently, is being looked into, and we are trying to improve the working condition there. We are involved in the working of the hospital in Kashmir, Bishop John Hospital in Kashmir, where we partner with the doctors working there. And our 2024 our team will be going for a medical and surgical camp there. There are many other areas where we are working. One of the main area of work is Nepal. 2023, we were able to go for a medical mission, traveling across different villages, difficult terrain of travel, but the missionaries who are working there, including Pastor Dil Thapa, is doing an amazing work, and we were able to partner with the work in Nepal. Many hospitals are going through struggles in India currently. We are focusing on improving the hospitals, the working condition of the hospitals, by providing them quality medical care, by improving their medical facilities, nurturing the staff in those hospitals, and providing them with adequate help in terms of finance and other needs, which goes a long way. I must at this point thank many of our donors, especially from United States and many other countries, who have provided amazing help which goes beyond the words, and I'm so thankful to the Lord for providing and wisdom and ability to coordinate the work in different parts of the country. Let me talk about the 2024 medical missions ministry that is planned. August, we will be in Bishop John Memorial Hospital in Kashmir for a week of medical camp. Then we move to Hyderabad, Baptist Memorial Hospital in Hanamakonda. Later on, we will be focusing our attention in Anagatti, Coimbatore, where we want to revive the medical work in Anagatti. Later in September, our team will be joined by the team from India working along with the Shiloh program in Christian Medical College, Vellore. And following that, we will be going to Mission Hospital in Kachwa Christian Hospital, where a surgical camp is planned in October 20th to October 25th. After Kachwa, we will be going to Madhipura for a week of surgical camp, following which November 2nd to November 9th, we will be in Sundarbans, Calcutta, to go ahead with the medical camps. We will be joined by Dr. John Umman, Annama John, both from Coimbatore, and Dr. Sam from Trivandrum, one of the dental surgeon, will join us in Kashmir. We will also be joined by, in Calcutta, we will be joined by the team from Women of Compassion, Dr. Helen Madumale and Ms. Vinaya George, and many other supporters for Helping Hands for Hospitals, including Mrs. Minoti from New Jersey, Ms. Shobhana Manohar, and Jesse Dickinson from North Carolina. Also, Dr. Miriam Thomas from New Jersey will join. The contribution of the Women of Compassion, the organization represented by Vinay George and Dr. Madhumale, is very encouraging to us. At this point, I must say a word about Reverend Gary. He is a great supporter, and his help is immeasurable. I must once again thank all the donors who have been working with us. We also appreciate the services of Ms. Fiba Philip based in Kerala, who works as the administrator and who arranges all the functions of the Helping Hands for Hospitals currently. At this point, I would like to once again give you the information about the Helping Hands for Hospitals, and I would like you to join our website at helpinghospitals.org, or you could send an email hhsecretary1@gmail.com, and those who would like to help us could send by cell at hhsecretary1@gmail.com, or those who partner with us could send to go online through the website. You could donate online, or you could send a check to the address 299 Green Street, Old Bridge, New Jersey 08857. Address to Helping Hands for Hospitals, 299 Green Street, Old Bridge, New Jersey. It has been a great privilege and a God-given opportunity for me to share this much information about the Helping Hands for Hospitals with Cinnamon and Houston Voice. God bless Houston Voice, and pray that this will become a great, amazing YouTube channel, talking to hundreds and hundreds of people. God bless you.